ergonomics, and what are the various occupational hazards, and how the occupational diseases have been classified. So all those things we have discussed in last class, but there was a lot of disturbance in last class because of the internal issues. Okay, so in this class I'll continue a little bit of the previous class, that is about classification of occupational diseases, and then the today's topic. Okay, so today's topic will discuss under these headings: classification of occupational diseases, how occupational diseases have been classified, and in this class we will discuss in detail about some of the important occupational diseases like pneumoconiosis, lead poisoning, occupational cancers, occupational dermatitis, radiation hazards, occupational hazards of agricultural workers, and accidents in industry. So all these topics we will cover in this class. Okay, so all these topics are important, especially the first topic, that is pneumoconiosis. It is an essay question for you. It is very important question, and the rest of the topics, one or the other will come for your exams as a short notes. Okay, so let's start. So first, coming to the classification of occupational diseases. So regarding this, I have just told you in last class how the occupational diseases have been classified. Basically, it is classified under 5 headings: physical agents, diseases due to physical agents, diseases due to chemical agents like dust, gases, or fumes. Due to dust, the diseases which are caused by chemicals, by inhalation of dust, is called as pneumoconiosis, and the diseases which are caused due to biological agents. So biological agents means the people who are working in close with the animals, like agricultural workers. So what are the diseases caused due to biological agents? And occupational cancers. There are so many cancers which are related to different occupations. And the diseases of the psychological origin. So that's how occupational diseases have been classified. The first one is diseases due to physical agents. So these things we have discussed in detail in last class. I just again refresh that. So the diseases due to physical agents are, the physical agents can be heat, cold, radiation, and all those things. Okay. So the diseases due to heat and cold, for example, burns, heat exhaustion, heat rash. It's also called as prickly heat, heat cramps, heat stroke, chilblains, erythrocyanosis, immersion food, and food bite. So all this frostbite. Sorry. So all these things we have discussed in detail in last class, right? So next, the agent is light. So due to light, excessive light, it can cause us eye strain or visual fatigue or minus nystagmus. And next is the noise. Because of excessive noise, it can cause hearing loss. It can be temporary or permanent, and also it interferes with the communication. Next is the vibration. So vibration, excessive vibration, continuous movement of the fingers. Because of excessive vibrations, what happens? There will be damage to the blood vessels that cause vibration, white fingers. And UV radiation. So UV radiation, especially people use UV radiation in art industries, like where they do welding and all those things. So that causes eye diseases, because people are more exposed to UV radiation, which affects the eyes. So that causes keratitis. That condition is called as welder's flash. Next is ionizing radiation. So exposing to ionizing radiations can cause cancers, leukemias, ulcerations, and sterility. So all these things we have discussed in last class in detail. So next, coming to the next group of diseases, those are diseases due to chemical agents. So chemical agents can be taken in the form of inhalation, like examples, dust particles, or ingestion, or through skin. Okay. So the most important and the most commonest type of diseases, a group of diseases, are inhalation of dust particles that are produced. Okay, so that group of diseases are called as pneumoconiosis, which causes lung diseases. Okay, inhalation of dust particles of size between 0.5 to 3 microns, which are inhaled by the person, and it causes lung diseases. So that condition is called as pneumoconiosis. So next is that diseases due to biological agents. So biological agents are nothing but those people who are working in close contact with the animals. So the diseases most commonly are brucellosis, anthrax, tetanus, and encephalitis. So next group are the occupational cancers. So examples like skin, lung, or bladder cancers are the most commonly seen cancers in different occupations. Next, the diseases of psychological origin. So, psychological origin means people psychologically they may get disturbed. So, in different occupations. So, no, common diseases are industrial neurosis, hypertension. They are prone for more hypertension and acute peptic diseases. So, these are the various ways the occupational diseases have been classified. So next coming to the in detail about the we already discussed the physical agents. So in this next will be the chemical agents. So the most common one under chemical agent is the dust particles. So the dust inhalation of the dust particles causes the lung disease is called as pneumoconiosis. So it is a lung disease results from the inhalation of dust particles of the size between 0.5 to 3 microns. So this size is very important. Those particles which is of this the particular size range are inhaled by the lung, person. Like those are the respirable dust. It is called as respirable dust. Okay. So that condition is called as pneumoconiosis. So basically, what happens here is these particles, the dust particles, which is inhaled by the lungs. So the in lungs it slowly develops into a condition called as fibrosis. That's called lung fibrosis. Lung fibrosis is the most common effect of the pneumoconiosis. That causes it decreases the working capacity of the lung. That's how it progresses. Okay. So let's see what are the various types of diseases comes under pneumoconiosis. Those are caused by different types of dust particles. So they are broadly classified. The dust is basically classified into two types. One is inorganic dust and the organic dust particles. So let's see what are the diseases which are caused by inorganic dust particles. So inorganic dust particles are coal dust, silica, asbestosis, and iron. So the coal dust causes a disease called as anthracosis. So anthracosis is most common in coal mines. The people who are working in coal mines because of coal dust, it causes anthracosis. And next is the silica. So because of the people who are exposed to silicon dioxide dust, that causes silicosis. Next, the asbestosis. So asbestos dust can cause disease called as asbestosis, and also it can cause carcinoma of lung. Next, iron causes siderosis. So these are the various diseases which are caused by inorganic dust particles. So next is the organic dust particles. So organic means these what is exactly organic means here. Those are produced from the plants. Okay, so it can be cane fibers. Cane fibers means sugar cane. So that sugar cane dust can cause us. This is called as bagasosis. So it's called as bagasosis, and the diseases which are caused by cotton dust. So those are produced from cotton plants in the cotton industries. So the disease is called as bicinosis. Okay, and the other variety is hay or grain dust. So that is mainly from the husk or anything that is produced from the paddy fields or any wheat fields. It's the outer layer, no? That powder, that dust is called as hay or grain dust. The disease caused by this dust is called as farmer's lung. So broadly, this is the classification of the pneumoconiosis, various diseases under pneumoconiosis. It is organic, inorganic dust and organic dust, and various diseases caused by these different types of dust. So this is very important topic for you. It is a main question. So please concentrate. So the first one is silicosis. So as I told you, silicosis is caused by the dust produced from silica or silicon dioxide. Usually this dust is produced from the various industries like mining industries, pottery, ceramic industries, sand casting, metal grinding, building and construction work, and iron and steel industries. Commonly, this silica or silicon dioxide dust is produced from these different types of industries. Usually, it takes around a few months to 6 years for the symptoms or disease to appear in a person who continuously inhale this dust particles. So the incubation period is few months to 6 years. And the disease is insidious in onset, like gradual in onset. The patient will be presented with symptoms like irritant cough, dyspnea, and chest pain. So these are the common presenting symptoms, and gradually there will be impairment in the total lung capacity. So as because of gradually the patient develops the fibrotic condition in the lungs, so there will be impairment of total lung capacity of the patient. So that is because of dense nodular fibrosis. So there will be dense nodular-like fibrosis that is formed in the lungs. And also this silicosis is most commonly associated with tuberculosis. Okay, they are more prone for disease called as tuberculosis. So that condition is called as silicotuberculosis. Okay, this is important, silicotuberculosis, because people who are having this silicosis, they are more prone for tuberculosis. So that condition is called as silicotuberculosis. You can see tubercle bacillus in their sputum. Okay. So this is a picture which shows the left side shows the dense nodular fibrosis. So you can see these are the nodules which are formed in the lungs. And on X-ray appearance, one of the characteristic feature in the X-ray is the this disease appears like a snowstorm. So if you take out the X-ray, there will be the lungs looks like a snowstorm. That's why the X-ray radiological finding shows snowstorm appearance. Okay, so this point is important. So that's about silicosis. So next condition is the anthracosis. So anthracosis is basically caused by the coal dust who are working in coal mines. Usually it takes up to 12 years of exposure, the disease will get appear. Okay. So it is of two types. The disease appears in two phases. First phase, it appears like a simple pneumoconiosis, and gradually it enters into second phase, and it appears like a progressive massive fibrosis, and then it leads to premature death. So these two phases are important. First phase, it turns as a simple pneumoconiosis. It presents as a simple pneumoconiosis. In second phase, it presents as a progressive massive fibrosis, and then ultimately it causes premature death of the patient. And this anthracosis in our country, it comes under a notifiable disease. So it is very important, those who are having this anthracosis, who are suffering with anthracosis, it is important to notify it to the higher authorities under the Indian Mines Act or Workmen Compensation Act, because this disease is a compensatory disease. So the patient will get compensated in the form of money or whatever, like leaves or anything. Okay, that's why it is a notifiable disease. So it appears like this on X-ray. So next is the bichinosis. So bichinosis is the disease caused because of the dust particles produced from the cotton fibers in the textile, especially it is most common in textile industries. The common symptoms presented here are chronic cough, progressive dyspnea, and chronic bronchitis, and finally the patient will end up with emphysema. So these are the common symptoms associated with bichinosis. So bichinosis is basically caused by the cotton fiber dust. So next condition is the begasosis. So begasosis is the mainly caused by the dust particles which are produced from the sugar cane. Okay, sugar cane. So this dust is also called as bagasse. So here what happens is, when there is a lot of there is a lot of accumulation of this sugarcane dust, what happens if when the conditions are favorable, like the moisture content in the sugarcane dust is good enough, it starts producing the fungus called as thermophilic actinomycetes. So that inhalation of that dust which contains the fungus in it, inhalation of that dust is called, that dust causes this Beggarsosis disease. So the most common symptoms presented here are the breathlessness, cough, hemoptysis and mild fever. On X-ray, you can clearly see the mottling appearance in the lungs, or it appears something like a shadow. Okay, that characteristically it appears like a mottling appearance. I'll show you in the next slide. So how can we control this Beggarsosis? It is mainly by doing dust control. So by keeping the dust under control, by frequent cleaning it up with wet mopping or something like that, and wearing some personal protective devices like proper wearing of proper face mask and respirators, all those things, and medical control like periodic examination of the people who are working in that particular place, and Bagos control. So Bagos control means keeping the moisture levels under control, and also by spraying 2% propionic acid, you can kill that fungi, that is thermophilic actinomycetes fungi we can kill by using 2% propionic acid. That's how you can control this Beggarsosis disease. So this is Beggarsosis. It's mainly caused by sugarcane fibers, dust, and then the X-ray it characteristically shows the mottling appearance. Okay. So next we'll move on to the next disease, that is asbestosis. So asbestosis is mainly caused by the asbestos dust particles. So here the incubation period is between 5 to 10 years of exposure, and the symptoms are commonly dyspnea, clubbing of the fingers, cardiac distress and cyanosis. So you can see clearly here the important symptom, that is important sign, that is clubbing of the fingers, and there will be cardiac distress and also cyanosis. These two things are commonly noticed in asbestosis. And the other symptoms like it causes pulmonary fibrosis and peribronchial or diffuse fibrosis. Means the lower lung is commonly affected, and the respiratory, and also it causes respiratory insufficiency, and finally it can cause death. And here on X-ray or radiology, the characteristic feature of this asbestosis is it appears like a ground glass on X-rays, and also in the pathological reports it shows asbestos bodies. So histopathology it shows asbestos body, on X-rays it shows ground glass appearance. These two are the important points under asbestosis. So these are the, on left side these are the asbestos bodies, and right side on X-rays it appears like a ground glass appearance. Okay, so that's about asbestosis. So next, the last disease under pneumoconiosis is farmer's lung. So the farmer's lung, as I told, it is mainly from the dust produced from the grain particles or hay dust, that is moldy hay or grain dust. So here also what happens when the favorable conditions are there, the fungus starts growing in it. Okay, inhalation of that dust causes farmer's lung. So here also the commonest fungi is the thermophilic actinomycetes. So the symptoms are commonly the respiratory symptoms, but this is not very severe disease. Only after so many frequent attacks only the patient will develop the pulmonary fibrosis. So that's about farmer's lung. So these are the various diseases under pneumoconiosis. So next coming to the other chemical agent, so which is very important is the lead poisoning. That is a metal which is most commonly used in so many different industries, and that has a lot of adverse effects on the human health. That's why it is important to know the about the lead poisoning. So So why this lead is commonly used in so many different industries in various forms? Because so the properties what it has. So it has low boiling point. Because of that, it can easily get mixes with the other metals, and it can get easily oxidized, and it has anti-corrosive property. So because of these properties, the lead is most commonly used in so many different industries for preparation of so many different items. Okay, so where do we exactly use the lead? So for the industrial purpose, we commonly use the lead in storage batteries, glass manufacturing, printing, and rubber industries. These are the common places where we use the lead. And non-industrial uses are this petrol, okay, gasoline for the gasoline production, and also for the preparation of toys, okay, which where we commonly use the lead. And also you can see lead most commonly in pipes, right? Like the pipes which we use commonly in the washrooms and all those plastic pipes. So on those places, this lead is commonly used. So how the lead is getting absorbed into the body? It basically gets absorbed in three ways. One is through inhalation, and that is the most common route, by inhalation of the dust or the fumes which are produced from the lead, and then through ingestion and through skin, that is by contact. So these are the three different ways the lead can get absorbed into the body. And how the clinical picture appears? By through because of lead poisoning. So lead can be of two types. One is inorganic lead and organic lead. So inorganic lead causes different symptoms and organic lead causes different symptoms. So usually the inorganic lead affects the GI system, and also organic lead it affects the CNS basically. Okay, so the symptoms for under or inorganic lead exposure are abdominal, most commonly abdominal colic, constipation, loss of appetite, and appearance of blue line on the gums. So this point is very important. You can see here in the picture. So you can see this is the blue line. Okay, I don't know how clear it is for you, but this is how the blue line is formed. Okay, in the gums. And and another important point is that you can observe stippling of the red cells in histopathology. So in this second picture, it shows wherever the arrow marks are there. So this is called as stippling. Stippling means there will be presence of very small dotted structures in the RBC. You can see, no, there is a difference between this cell and this cell. So this red cell is called as stippling red cell. So this is a characteristic feature of lead poisoning. Okay, and also it causes anemia and wrist or foot drop. So these are the common clinical features because of inorganic lead. So it can causes abdominal pain, constipation, loss of appetite, and presence of blue line. So this is blue line, and there will be stippling of red cells, then anemia and wrist or foot drop. So next, coming to the symptoms related to organic lead exposure. So organic lead exposure can basically affect the CNS. Okay, so CNS involvement will be there. The symptoms will be most commonly insomnia, headache, mental confusion, and delirium. So these are the common symptoms presented with organic lead exposure. Coming to the preventive measures, how do you prevent the lead poisoning? So it can be done by substitution. So substitution is nothing but simply by replacing the lead with some other what you call non-harmful chemicals. In place of using lead, we can use some harmless chemicals. Okay, that is called as substitution. Then isolation. So isolation means wherever the in the factory, wherever the lead tanks, wherever the this lead fumes or dust which is getting produced, okay, those has to be segregated and close it or cover it properly, so that the dust or fumes that shouldn't get escape out and the people shouldn't inhale it. So that condition is called as isolation. And local exhaust ventilation, proper provision of proper exhaust ventilation for escape of the this dust or fumes. Okay, that has to be provided. and personal protection. So personal protection means by using proper protective measures by the workers who are working in that environment, like by using proper masks, respirators, and all those things. Okay, or by using proper gloves and all those things. Okay. Next is good housekeeping. So good housekeeping means immediately as soon as wherever the dust is getting produced, by cleaning it and keeping the environment clean. Okay, by doing wet mopping and all those things. Next is working atmosphere also has to be kept clean. Next, periodic examination of the workers. So this is important. Periodically, we have to screen the patients who are working with the this who are working under these conditions for checking whether they are exposed to any lead this thing or not. Okay, next is personal hygiene. So personal hygiene includes frequent hand washing, those people who are working and who are in close contact with this before eating their food or anything, so they keep cleaning their hands, and so provision of good amount of water and all those things has to be provided under personal hygiene. And lastly, the health education. So health education is important for the workers who are working there. We have to tell them how to keep things safe and how to maintain personal hygiene, how to protect themselves from getting exposed to this. So all this will be taught under health education. So these are the various preventive measures under lead poisoning. So this is very important question. It is a short notes for you. So that's about lead poisoning. And next topic is the occupational cancers. So occupational cancers are basically the most commonly, these are the common cancers like skin cancers, lung cancers, cancer bladder, and leukemias. These are the four important cancers which are commonly you see under different occupations. The first is the skin cancer. So skin cancer is the most commonly we can see in workers like who are working in gas industries, oven workers, oil refiners, road markers, or road makers, and workers uses mineral oil or tar. Means who are like especially working in tar related works. Okay, like who are worked in making roads and all those things. So those people like they directly have contact with those chemicals. So these skin cancers are very much common in them. And the first skin cancer that was noticed way back was the carcinoma scrotum that was observed in chimney sweepers due to this coal tar. Okay, those who get exposed to this tar, that is coal tar. So the carcinoma scrotum is the first skin cancer that was noticed. Okay, in chimney sweepers. Next cancer is the lung cancer. So lung cancer is most commonly seen in gas industries, asbestos industries, nickel and chromium industries, and radioactive mines and coal tar. So these are the industries where you can commonly see the lung cancer. So these lung cancers are usually get aggravated with people who have the history of smoking. Okay. Next is cancer bladder. So cancer bladder is most commonly seen in people working in rubber industries and especially dyeing industries. Okay, where they use dyes, different types of dyes. Okay, in them this is the most commonest cancer. Okay, so the rubber industries, dyeing industries, gas or electrical cable industries. So the dyeing industries, especially the chemical called as aniline dyes. So that aniline dye is the most common cause for cancer bladder. Okay. So the chemicals like aromatic amines, examples beta naphthalamines, benzidine, and auramines. So these are the various chemicals responsible for cancer bladder. Next is the leukemias. So leukemias that is related to blood. So these are mainly because of caused by chemicals like benzol, roentgen rays, radioactive substances. Okay, so these are the various radiation related chemicals which can cause leukemias, and it takes usually long time for disease to appear. Like it takes around 10 to 25 years. Like longer exposure is required for getting the cancers. So these are the various occupational cancers. How do we control these occupational cancers? It is simply by elimination or control of carcinogens, like which by less utilization of the chemicals which causes the cancer, and medical examination, that means periodic health checkups of the people who are working under those conditions, and inspection of the factories. Okay, periodically inspection of the factories, how much they're using these chemicals, how to control it, all those comes under inspection. And notification, licensing and personal hygiene. So notification means those who develop these cancers, immediately those diseases has to be notified, okay, for further control, licensing, personal hygiene and education of the workers. So these are the various control measures to control the occupational cancers. So that's about occupational cancers. Next is the occupational dermatitis. So this occupational dermatitis is very, very common in any type of occupation. People who are working because we use lot of chemicals in different industries, and people will be in close contact with those chemicals that causes the skin reactions and causes dermatitis. So dermatitis can be because of various agents, like physical agents, like people who are working in extreme hot or cold conditions, or with moisture, friction, or under high friction or pressure, or who are exposed to high X-rays, can lead to dermatitis. And those then chemical agents, like those who are getting exposed to chemicals like acids, alkalis, dyes, solvents, grease, tar, and phenols. So all this can also cause skin reactions and cause dermatitis. And biological means those agricultural workers who are in close contact with the animals, or who will get exposed to biological agents like virus, bacteria, fungi, and parasites. Next, primary irritants, like which are irritable to the skin, like acids, alkalis, dyes, and solvents, and sensitizing substances, like which are like allergic to the skin. So all these factors are contribute to the condition called as dermatitis. So how do you prevent this dermatitis? It is simply by pre-selection. So pre-selection means before selecting a worker who has to work under these conditions. So you have to properly examine the worker, like who are more prone to these kind of diseases. Is we have to better avoid that person to put it him into this work. Okay, so that is the first thing, that is pre-selection. Next is protection. By protection means by proper taking of precautions and protective measures by using like long leather gloves, aprons, boots, or protective clothing and all those things, and by using of barrier creams. Okay, all this comes under personal protection. Next is personal hygiene. So personal hygiene indicates thorough hand washing things. Practices with soap and water has to be practiced regularly, and then periodic examinations. So periodic examination helps for the people or workers to early identification of any disease and replacement. So replacement means those who are working continuously for long days. Okay, for many days. So better to replace with some other people by giving some breaks to them. So that is called as replacement. So that's how we can prevent this dermatitis, mainly by pre-selection and giving by taking proper personal protection and personal hygiene, by doing frequent hand washing and periodic examination, by frequent health checkups and replacement. So these are the various measures we take to prevent the dermatitis. So next is the radiation hazards. So radiation hazards are mainly because of people who get exposed to a lot of radiation. Those are like who gets exposed to X-rays, UV rays, and infrared rays. So there are various different types of radiation. So what are the hazards? So basically, it can affect like temporary, immediate effects will be, there will be burns, there will be dermatitis, and blood dyscrasia. So these are the most common acute conditions and by prolonged exposure to radiation can also causes malignancies and genetic effects. So these are the various effects produced by radiation exposure. And what are the preventive measures for this? So better is to avoid exposure as much as possible. As much as possible, it's better to avoid getting exposed to the radiation. And shielding. Shielding means by wearing thick, proper aprons like lead shields, which we commonly use for getting protected from radiation exposure. Proper utilization of lead shields and film badge or pocket electrometer. So this film badge or pocket electrometer is basically used to monitor how much you are getting exposed to the radiation. Okay. So that film badge also has to be replaced periodically, at least like 6 months once. It has to get replaced. Okay, for better performance and proper wearing of proper protective clothing and replacement on periodic examination. That I have told you what it means. And then lastly, the pregnant worker has to get exceptional or has to get avoided from getting exposure. So these are the various ways you can prevent from the radiation hazards. And the next is the occupational hazards of agricultural workers. So what are the normal occupational problems which are associated with people who are working in agricultural field? So as I told you, they are more in contact with the animals. Okay, they are in close contact with animals. So there will be so many diseases related to animals. So those diseases are called as zoonotic diseases. So examples are brucellosis, anthrax, leptospirosis, tetanus, and tuberculosis. So they can prone for any of these diseases, and then even they can prone for accidents. So accidents are mainly because of using of this agricultural machinery. So we use a lot of machinery for different agricultural work purposes, and also in India especially, most commonly you can see accidents with insects or snake bites. Snake bites are very common, right? Okay, next is toxic hazards. So toxic hazards are because of the usage of the chemicals like fertilizers, insecticides, and pesticides. Next is physical hazards. So physical hazards, it means that those people, the farmers or agriculturists who will be working in very hot temperatures, humidity, or who they frequently get exposed to solar radiation and excessive noise or vibration. So those comes under physical hazards. Next is respiratory diseases. So respiratory diseases means pneumoconiosis. So they can also get exposed to some of the organic type of pneumoconiosis, that is byssinosis. That byssinosis means diseases which are caused because of inhalation of the cotton fibers. Okay, bagasosis is inhalation of the sugarcane fibers. Farmer's lung, that's mainly because of hair particles like what you call husk produced from the paddy or wheat. Okay, and they can also prone for asthma. So these are the various diseases which are related to agricultural workers. Okay, occupational hazards related to agricultural workers. Zoonotic diseases, accidents, toxic hazards because of fertilizers or insecticides, pesticides, physical hazards, then respiratory diseases. So next coming to the last topic, that is accidents in industries. So what kind of accidents can happen in industries? So the causes for these accidents in industries are broadly classified into two categories. One is human factors and environmental factors. So the research or the study says that human factors are more responsible for accidents in the industries. So human factors include physical factors, physiological and psychological factors. So usually it contributes to 85% of all accidents, okay, which occurs in the industry. The physical causes can be because of visual acuity. Okay, that is visual acuity. If the person, if he has any visual problems, we cannot have proper sight, okay, vision. So it can lead to accidents, and also if the person cannot hear properly, okay, he has any hearing problems or impaired hearing, okay, hearing loss can also cause accidents. Next is physiological. So physiological factors like sex. So usually men will get more prone to accidents than women. Then age. Age is usually age people will I mean younger age group will get affected more than older age group. But again, the more older age groups people also get affected. And then time. Time usually the accidents are more common in the later part of the day. It means in the during the evening or night, because people get fatigued by the time they do continuous work. So those so accidents are more common during the evening times or night. And experience. So experience means work experience. Those people usually the accidents are more common with the people who has work experience of less than 6 months. Okay, in the beginning of their occupation. Okay, starting of their occupational career. Okay, and then working hours. So working hours also later hours, like in the evening or late night hours, the accidents will be more common. So these are the various physiological factors related to accidents. Next, the psychological factors. So psychological factors could be carelessness. So some people will be very careless and inattentiveness. Doesn't pay any attention while doing the work. And some people may have overconfidence, and some people will have emotional stress. So all these factors also contribute to psychological causes of for accidents. So that's about human factors. Next are the environmental factors. So environmental factors contribute to very less percentage, that is 10 to 20% of accidents are because of environmental factors, which can be temperatures like high temperatures or low temperatures, working in those temperatures, and poor illumination. Illumination means the light. Then humidity, noise, and unsafe measures. So these are the various causes of accidents in the industry. So next, coming to the prevention. So how do you prevent the accidents in the industry? So it is mainly done under these measures like pre-placement examination. So pre-placement examination means before you taking the person into work, it is very important to examine and perform his work, how much he is well with the work. So that is called as pre-placement examination. Next is adequate job training. Next, after placing the person into the work, so it is important to adequately train the person to prevent him from getting accidents. Next is continuous education. So by creating awareness, okay, frequent educational sessions has to be provided to get the for updating of the knowledge in that particular field. Next is ensuring safe working environmental conditions. So always like keep in check with the machinery and all those things, whether they are in good working condition or not. So that is about ensuring safe working environment. Next, establishing a safety department. Then periodic surveys. So periodic surveys means periodic checking again, like different equipments which are used in the industry, and careful report. So this is how you can prevent the accidents in various industries. So with this, here I'm ending today's class. Thank you. And the next class, we'll continue the same chapter. The topics will be sickness absenteeism and health problems due to industrialization. So because of industrialization, what could be the health problems? And how do you prevent all these various occupational diseases? So those can be discussed under these headings like medical measures, engineering measures, and legislative measures. So with these topics, I will come with for the next class. So next class, I'll complete the chapter, this occupational diseases. Okay. Thank you.